Imagine you are sitting in a doctor's office. The doctor walks in, introduces himself, and it seems like in a flash you have been given a diagnosis, a treatment option, and a prescription to fill. The doctor shakes your hand and heads off in a rush to see his next patient. An important appointment done in the blink of an eye. A prescription you can't pronounce, a stack of papers you'll never read, and left with things you wish you had clarified.
This makes no sense. I wish there was something that did.
Health literacy has been an examined issue in the U.S. for over half a century, and the problem is still prevalent. After many years of attempted solutions, the Department of Health and Human Services still estimates that nearly 9 out of 10 adults have difficulty using the everyday health information that is provided for them. That translates to approximately 233.5 million adults. The National Assessment of Adult Literacy produced striking results emphasizing that approximately 88% of adults lack the health literacy needed to be regarded as proficient. There also seems to be a correlation between ethnicities associated with foreign languages and below basic health literacy. In our own sample survey of 298 individuals across 32 states, a vast majority of individuals reported not understanding a term used by a doctor. Along with that, 89.3% of individuals that took our survey expressed interest for a free app that would enable them to comprehend complicated terminology. Our study also found that about 50% of participants were near the age of 20 and had some college education. Considering that our survey sample was composed primarily of college-educated and college-aged individuals, our team believes that even worse rates of health literacy would be seen if a sample truly representing the U.S. population was conducted.
Hey, how's your shift been so far?
It's been alright. How about yours?
It's okay. I feel like most of the patients I've been seeing just aren't really getting what I'm trying to tell them. I ask if they have any questions, but probably less than half of them ever say that they do.
Yeah, I've noticed that too. I wish we had more time to explain it to them, but we have other patients to see.
Exactly. It would be so much easier if they had a way to get clarification on their own without having to come back and ask us.
Hey.
Hey.
So I had this appointment today, and I'm still confused about my condition. I mean, I honestly couldn't even tell you what my prescription even is. And I mean, you know those stack of papers they give you? I always lose them before I even read them. And I mean, I would ask my doctor for clarification, but I don't want to be annoying or seem stupid.
Yeah, I don't like asking my doctor questions either. I try to Google everything after the fact, but I can never find anything useful.
Yeah, it's awful.
Like, all I find are walls of text and complicated terminology. Oh, but that reminds me. The other day, my doctor introduced me to this app. It's called McCollough.
Introducing Magnify Med, Understanding Made Easy. In this section of the video, we will outline the purpose, design, features, and pricing of our app. We will then hear from doctors who have endorsed it. What is Magnify Med? Magnify Med is an app innovated to give patients the direct tools they need to navigate the world of personal health. We believe that every patient has the right to accessible and easily comprehensible resources. The overall goal of Magnify Med is to improve patients' health and well-being. Moving on to our product design, Magnify Med is designed as a virtual glossary which houses all of the up-to-date information regarding diagnoses, prescriptions, treatment options, and other terminology. Magnify Med's product features include 4 main sections: diagnoses, prescriptions, treatment options, and general terms. Users will be able to search the app's database for any questions they may have. The information available regarding diagnoses allows patients to gain insight on their conditions. The prescription section is intended to clarify dosages, directions, and warn of any possible side effects. Information on treatment option outlines what a procedure would look like and describes various treatment options. There will also be a general terms section that acts as a catch-all for all other medical terms. Moving on to the pricing aspect, the Magnify Med app is free to download on any smart device for all patients, and hospitals and private practices will purchase the rights to our app and provide accounts for the patients. We will now hear from some physicians that have endorsed our product.
I think it definitely is a problem. There's a lot of levels to this problem. I think it's just for their own knowledge and peace of mind to understand what's going on with themselves. And I think it impacts on different levels. Like if someone's getting admitted, it's a little bit less worrisome because, you know, they're going to be in the hospital for a couple of days and kind of have different specialists see them and have a lot more time face to face with providers to explain things, but especially patients who go home, if they don't understand, you know, what tests were done, what the results were, what their diagnosis is or lack of diagnosis, and, you know, who they need to follow with and return precautions. That's a danger for them. And it's a danger for, you know, the healthcare providers too, from a medical legal standpoint as well.
Patients who go to, say, Dr. Google or WebMD or anything, I usually suggest to them that if it's an open source media platform that is not being edited or critiqued by a medical professional, or if I know, or if there is a pop-up ad, if there's any sort of advertisements on it that is not a reputable source, right? So if there's a pop-up ad or anything that does, and if the site does not say .gov or .cdc kind of behind it, then that's not a reputable site.
Right.
So if anybody's making money on it and it's open source and you can put on there that dragons cure cancer, that's not a reputable site. If anyone can open source edit, it's not something you want to rely on. Because if you look at Dr. Google, you can come in for a UTI and think you're dying of some sort of obscure nasal cancer. Like, who knows?
Using Dr. Google. Yeah. So, I mean, I'd say, you know, we see it from kind of a different perspective because they look at Google before they come in.
Right.
So, you know, they're going on like, you know, WebMD or whatever and putting in their symptoms. And they all are convinced either they're going to die or that they need a specific test. And they are medically, you know, not as well educated as, you know, a doctor or a nurse are. So they come in with certain expectations or certain concerns that aren't necessarily valid. And it can lead to, you know, it can lead to running more tests than you need to just to kind of give them peace of mind. It can lead to them feeling that they weren't properly treated. It can lead to a lot of confusion and just problems that didn't need to exist because they look something up on the internet and have this misinformation. And it's not always that it's the wrong information. It's just, it doesn't necessarily apply to them. You know, not every time that you have belly pain are you going to have cancer, you know, so those types of things.
Yeah, I mean, I think it'd be very helpful. You know, it's just a lot of things when you're talking to our patients. And sometimes I just wonder if we could just talk to them normal and just try to explain things. And other times, like you said, we're talking about language that they're used to hearing. So all in all, they're actually probably learning twice as much or 3 times as much as they probably should have because we're going through all this different language and explaining. But yeah, if you had an app that could, you type it in and you had, you know, definitions for it that were more or less accurate for the, you know, most of America, I think would be very helpful.
Yeah, absolutely. I think that'd be a great resource. Because like you said, really all they get from us is, like you said, a bunch of papers that have all of their results in it and follow up here and call this doctor. But I think where it lacks is them going back and getting more information about specific things they have questions about. And unless they're going to see their doctor or someone in the next couple of days, it's probably something that just slips their mind, you know? So I think it'd be a great resource.
Something like say this app, why it would be a good idea if it's designed by, you know, medical people for the patients rather than just, you know, as you probably already know, like patients can Google anything they want, but it's hard, you know, Google has so much information and it's hard for them to interpret it. I mean, they just, you know, read one thing and automatically think they have the worst diagnosis.
As future physicians, we are all extremely concerned with the high levels of health illiteracy in the U.S. It is not only detrimental to the healthcare system, but also affects thousands of lives each year. We developed a viable solution to this problem. All we need now is your support. So ask yourself, how much does health literacy mean to you?